I'm Lance,
I'm Mike.
and we are just these guys, you know?
Welcome to another week. So I've got an idea
Yeah.
that I want to talk about this. I mentioned it earlier, and it's kind of like the elephant in the air, and that is the topic of depression and the topic of suicide.
Correct.
This is February the 7th as we're recording this, and I have an aunt who 1 year ago took her life because she just was overcome.
I'm so sorry.
With depression. I just believe that people reach a moment of weakness that is too dark for them to find their way out.
Right.
I've seen faithful people, and she was a faithful person. She was a believer.
Right.
I've seen strong believers go this way. I've seen people who have no faith go. It plays a role, but ultimately, if we continue to just allow it to be the elephant in the air, the elephant in the room, we're going to lose some people who reach those weak moments where we might be able to do something. Because that's what we all feel.
Sure.
We all feel. Because we all know somebody. Or if we don't know somebody personally, we know somebody who knows somebody.
Yeah.
This is an issue that affects every family out there. And so I'm just, as a psychologist, I want to get some of your thoughts on how people, like what we can do, and some of the thoughts behind what they're feeling. I'm just going to let you talk.
Sure. Well, you mentioned the elephant in the room, the elephant in the air,
Mm-hmm.
and when it comes to depression and certainly the idea of suicide, that is the elephant in the room that people don't want to talk about.
Right.
And they don't want to talk about it because they don't know what to do. They don't know what to say. And
Sure.
So they don't say anything.
Yeah.
And I would encourage people listening to this as we go through it, if you feel upset, if you feel emotions coming up, please know there is a suicide hotline now.
Right.
And it is 988.
Mm-hmm.
And if you can't remember 988, always remember to call 911. Yeah. They're not going to send the police to arrest you. They actually have access to all sorts of emergency services, and depending on the community, they have mental health crisis vans or units that can come out and talk to you, talk to your wife, your child, but make a phone call. When in doubt, make a phone call.
Yeah.
There's the worst thing we can do in these situations is not do anything.
Sure.
In the local area here, the crisis line is 316-660-7500, and we can Google anything nowadays. So
Absolutely.
Please, if you're feeling anything, pick up the phone, pick up the Google, and locate somebody to talk to or some services.
Yeah.
So the idea of depression, I think most of us know what it kind of feels like and looks like. And so statistically speaking, the concept of a severe depression is less common. And depending on the study you read, it's estimated to be anywhere from 6% to 25% lifetime that somebody will experience a severe depression. And at any given moment in time, we estimate about 10% of the population is experiencing a severe depression. And what do you do with that number? When you're standing in a crowd, when you're speaking to your congregation, recognize that there's a 1 in 10% chance, or 10% chance, 1 in 10 chance that somebody sitting in that audience is severely depressed. And if there's 200 people in there, there's 20 people.
Yeah.
So this is not an uncommon thing. I know 10% doesn't sound like a lot, but when you look around your family,
Sure.
10%,
Wow.
there's one person in your household, there's a fair chance they're severely depressed. The signs of a severe depression, and this is not to minimize moderate or mild depression or any other kinds of depressions that are out there.
Right.
They're all difficult to deal with. They all make us miserable. But the severe depression, if you're experiencing insomnia, you can't sleep at all, or you're sleeping, 18 hours a day, 12 hours a day, and you're ready to go back to sleep as soon as you get up.
Yeah.
Irritability, a loss of interest in things that you used to enjoy, hopelessness, persistent thoughts of something bad happening, obviously thoughts of death or suicide attempts, and in very severe cases, some people may actually experience hallucinations or delusions.
Wow.
And so somebody may be severely depressed and hear the voices of their ancestors or their grandparents. So they also have trouble with what we call ADLs, activities of daily living. So bathing, cleaning the house, feeding themselves, taking care of work responsibilities. When they're severely depressed, these things tend to fall away because they can't get out of bed. They have no motivation. They feel hopeless. They feel, why bother? Their thoughts are persistently focused on something bad happening, so they're not going to get in there and unload the dishwasher today.
Yeah, right.
Now, if you know somebody who is expressing these kind of things, looking like that, talk to them. And when I say talk to them, that's when people say, well, I don't know what to say.
Yeah.
Go to them. Put your hand on their shoulder. Ask them how they're doing.
Yeah.
Sit with them.
Yeah. We've called that just the, in church we call it the ministry of presence.
Right.
But just your presence.
Yes.
You don't have to worry about having the right words.
No.
You don't have to worry about being an expert on depression and anxiety. You just be there.
In fact, in those moments, the last thing they need, the last thing they want is to hear your little bits of advice.
Sure.
They just want somebody to be present so they know they're connected, so they have somebody there to be with. And if in that presence there's a conversation that occurs, great. But otherwise, listen, let them talk, and just be present. The ministry of presence. Perfect.
Yeah. Walk in and realize that God has given us 2 ears and 1 mouth, so just listen twice as much as you speak, as the saying goes, and be there. That's so huge. But being willing to, and this is what I'm trying to do a better job of, and I do a poor job of it, but being open to seeing the signs, being open to being willing to be interrupted with what you feel like is what you got to get done today, what your plan is today, but just to be sensitive to the people around us, to be able to recognize, because so often it's an isolated situation where they are just, it's like they're drowning.
Right.
And it's silence. They're drowning in their own little world, and we need to be sensitive to what's going on in their world. We get so wrapped up in everything in our own world.
Correct.
That it is challenging, but if we have a heightened sense of awareness of it, if we want that, if we desire that, and we don't continue to allow it to be the elephant in the room, and I just really think that even just one person, if we can help one person, it's going to be worth it. It's going to make a difference.
And a lot of times with people who are depressed, they do fall through the cracks because they withdraw.
Right.
And we don't recognize that withdrawal as a sign of anything. In fact, we sometimes take that as freedom. That particular church member has stopped calling every day. Thank goodness. Now I can get back to what I was focusing on doing. And I've been asked this question a lot, is what are the signs that we need to look for as people who are not trained in mental health?
Yeah.
And the best advice I can give people is look for changes. Think about their normal patterns that they've exhibited over the last 6 months or a couple of years, and if those start to change. If they're not calling you as much, if they're not going out as much, if they're not showing up to church, if they're not cleaning the house, if they're not going on their bicycle rides anymore. If you see these kinds of changes, that's suggestive that something's going on inside their mind, that it could be depression. It could be other things, but
Sure.
As a untrained person who just has family members or somebody who has a congregation and a flock to watch over, sometimes the absence of a sign is a sign. And so just watching for changes.
Yeah, that's good. Well, I know that, like I was saying, we all either know somebody or we have somebody close to us who has experienced severe depression, has experienced, we've experienced loss through losing someone that we feel like, because this is natural for us to feel this way, that there should have been, must have been something that we could have done different for them.
Well, and the truth is, and this is what a lot of mental health professionals have to learn and come to grips with, is there is nothing you can do or could have done or should have done or would have done. One of the things when I was trained at the hospital, when somebody come in depressed and suicidal, before we would let them out, we'd have them sign a suicide contract. And the contract was, if you felt like injuring or hurting yourself or killing yourself, you would do these things first. Usually call a family member, call a friend, call a mental health professional, call 911. And we would walk through the contract with them. And if they agreed, they would sign it. And that was a step towards being released from the hospital.
Wow.
But what was interesting is the people who seriously intended to do it, they would sign the contract.
Wow.
Because that was the way out. So, this little tool we have to kind of measure compliance and motivation and hope is, will they sign this or not? Some would say, I can't sign that. And then we would keep them around for a few more days to work with them to help them feel better, to where they felt they could go out on their own. But if they're going to do it, they're going to do it. And they're going to, say, sure, I'm fine, I'm doing great. And that's a lot of times the last words people hear from somebody like that is, I saw them the other day and they said they were doing great.
Yeah.
I'm so shocked this has occurred. And so the guilt and the blame game is not helpful. The main thing that can be helpful is if you see something, say something.
Sure.
If you see that change in their behavior, if you see that change in their mood, is to reach out, call a family member and say, hey, Charlie seems to not be looking real well at work. Is everything okay? You might want to go check on him.
Yeah.
But you can't blame yourself for it, because even psychologists, all the fancy instruments we have and the training we don't have a very good track record of predicting it either.
Sure.
And that's what research has shown us. It's not really predictable. There are signs that we can look for that somebody is feeling suicidal. And some of those signs might be that, they're talking about wanting to die or wanting to kill themselves. They're looking for a way to kill themselves, or they're searching for this online. They're talking about feeling hopelessness or having no reason to live, or feeling trapped, or that they're in unbearable pain. They're talking about being a burden to others. They're increasing their use of alcohol or drugs. Maybe they're acting more anxious or agitated, sleeping too little, too much, again, withdrawing, and maybe displaying extreme mood swings. But ultimately, it's not, predictive, but it is putting them in a higher risk category.
Yeah.
If they have family members in the past who have taken their lives, there's other risk factors that, we can look for to try to figure out if this person's at a higher risk. Risk factors for suicide, a current or past history of substance abuse. There's a greater degree of likelihood they will actually follow through and kill themselves if they're abusing substances. a past history of suicide attempts, family history of suicide attempts that tends to normalize the action that if a parent or grandparent or sister or brother have done it in the past.
Yeah.
If there's a family history of mental illness or substance abuse, that would suggest that what they're struggling with is more entrenched and more difficult to deal with than somebody who doesn't have that past history. If they have firearms in the home, that's a higher risk factor. If they've been incarcerated, if they're expressing feelings of hopelessness, things they may say or in some shape or form that might raise the risk level as we're observing that person. If they talk about, they can't stop the pain. A lot of people in chronic pain get to a point where they're just so overwhelmed by their aches and pains, their backache, their headaches, their neck aches, the surgeries aren't working.
Right.
And they're getting frustrated about not being able to stop that pain. If they can't make decisions, and you'll see them kind of going back and forth about things, and they just can't really ever come to a decision about stuff. If they can't see a way out of their situation, or if they're expressing feelings of hopelessness and helplessness and worthlessness. And so phrases they may drop here or there when they're saying these kinds of things, there's higher risk levels here that they're depressed, maybe severely depressed, and certainly we want to be aware of suicide as the ultimate option that they may choose. So when you hear these kind of things, take action. You can apologize later if you're wrong.
Sure. Yeah, and if we were gonna, put into action just the idea that being there, being present, is the most important thing. I think if there was anything that we were to say from a spiritual perspective, if they're wondering, because a lot of times they're wondering to themselves, where's God? Why do I feel this way? If God is such a good God,
right?
It doesn't feel like He's with me or for me,
right?
I believe where the Scripture says that God is with the brokenhearted, that we can just encourage them that He is. He cares.
Yes.
He's here, and He may very well be here through me.
Yes.
He's there through us. And so that's where our presence is critical.
Well, a question that comes up, and I've heard it a number of times, is the family member of somebody who committed suicide, their concern is because they committed suicide, they're not going to heaven.
Right.
And as a pastor, do you have any thoughts about that?
I don't believe. My personal belief is, and I just don't think that you find anywhere in Scripture where it talks about condemning people who take that. The same God who was willing to put on skin and come here for our brokenness, come into the darkness, bring light into the darkness. I don't believe that that's the same God who would condemn someone to an eternity separated from Him, an eternity in hell because they reached a dark place and a weak moment. I believe that God, like I just said, is with the brokenhearted. He came for us, and He was willing to go all the way to death for us. So there's not a place that's dark enough for Him not to bring light into.
Right.
And I just believe that grace, the grace that we have been covered with, the blood of Christ, is there for us, maybe especially in our weakest moments.
Sure. So to be clear, if my brother commits suicide and he has been saved for 5 or 6 years,
sure,
he's going to be in heaven when I get there.
That's exactly what I believe.
Okay.
Yeah. 100%. Well, thank you, Doc.
Well, and real quick, from a mental health side, please know that if you have any kind of feelings of depression or anxiety or grief, or you've experienced trauma in the past, treatment is 60 to 80% effective for severe depression.
Wow.
The problem is that about 25% of people who are severely depressed, they don't seek out the treatment.
Sure.
And they're the ones we, have to worry about as to following down that road and heading towards suicide.
Mm-hmm.
But and I'm not here to endorse a treatment. I want you to go to your family physician or your own therapist and talk about these things. But there's medications, there's different types of talk therapy,
Mm-hmm.
there's various ways to treat severe depression, and these ways work.
Yeah.
So please, if you're feeling depressed, please pursue treatment. And again, those numbers, the National Suicide Hotline is 988. Pick it up, hit those numbers, call. Somebody will be there to talk to you. 911 is always a good number to call. Those people are ready to listen and get you the emergency help that you need. And then finally, in the local area here, 316-660-7500 is the crisis line. But, grab Google, type in crisis line near me. You're going to get an answer. And make sure that you do seek help. And if you know somebody who's struggling and you're seeing something, say something. You can always apologize later, but do step up, do intervene, and do ask how they're doing.
Absolutely. God loves you.
And I want to thank you, because that's a difficult topic to come in here and talk about.
Mm-hmm.
Your personal experience having lived through this.
Yeah, it's as you're experiencing it.
So I remember at the time when it was going down and the aftermath, you still had to carry on with your duties of tending for other people, but you yourself were struggling with thoughts of guilt and worry and depression and sadness and replaying, the previous weeks and months, trying to figure out what you could have done differently, what you didn't see.
Yeah.
It was a difficult time for you.
Yeah. As my, my dad has, I always struggle if I feel like I'm making it anything about me.
Right.
That may be part of what leads people to isolating and becoming depressed.
Sure.
As I look back, because my dad is always asking me, "Are you okay?" He's good at if he feels it, he asks it.
Yeah.
He's very good at that. And
now I've seen him do that too.
Yeah.
So that's.
And 9 times out of 10, I tell him I'm okay. 9 times out of 10, he was right to ask.
So 9 times out of 10, you were not okay.
Exactly. Exactly. And so,
and again, for the audience here, your dad's stepping up. He's asking, "Are
Exactly.
you okay?" You're saying, "I'm fine."
Yeah.
What if you weren't feeling okay and he didn't ask? How would that feel?
Yeah, it would feel like I need him to have my back and to ask. Even if I say no, it feels better having him ask. And then I get to where I feel I'm pushed just a little bit to maybe next time he asks, I'm going to really tell him how I'm feeling. Because there is a weight that it's like the old analogy of duct tape. Every time you put it on a surface and you take it off, it picks up some of what was there. And then as you continue, it just gets less sticky, less effective.
Right.
And so ministry is that way.
Yeah.
Where you carry a little bit of every situation with you, and then eventually you become ineffective unless you deal with the fact that you need to process.
Correct.
You need to talk to somebody. And so I am absolutely, I'm with everybody in terms of knowing that there are certain things that we have available to us to be able to receive the help that we need. And so for somebody who might hear this, I hope that that's exactly what can happen. Just reach out.
Sure.
Yeah.
Just reach out.
Both directions.
Both directions. If you're struggling, reach out. If you see somebody struggling, reach out to them.
Yeah, absolutely. Thank you.
Well, this has been another episode of We're Just These Guys, you know. I'm Lance.
Mike.
We're Just These Guys, you know.
And tune in next week for another episode of the podcast.
See you.